We're here today to talk about public health and Medicaid collaborations, and I like to think as doctors, nurses, pharmacists, and our healthcare providers are sort of they're there to heal patients and on the ground, boots on the ground, with all the tools they have at their disposal to create a healthier country. And as policymakers and payer organizations, public health and Medicaid are really there to use their levers to make the system healthy and heal the system as well as we go along. And in Louisiana, we've done, especially around the work of HIV and Medicaid, we have had a very strong partnership with them in many other areas, first in birth outcomes, and we've extended it to other areas within their MCO, Managed Care Organization contracts. And HIV has been a focus area. And in Louisiana, we've done a lot of work in prevention. We're seventh best in the country in testing rates, and we still have a ways to go in that. But we've also spent a lot of investment and time in improving coordination of care. So we have set up systems that create point-of-care alerts to providers to keep HIV patients and retained in care, and our now percentage compared to the national percentage of 40% of patients are retained in care nationally. Louisiana has a 78% retainage rate, and then retention rate, and then among those that are virally suppressed today, before we began our work with Medicaid, the national average, according to the CDC, is around 30%. And in Louisiana, due to a lot of the interventions we've had, we have a 44% viral suppression rate. And so as we look to Medicaid, Ruth Kennedy, the Medicaid director for Louisiana, and I agreed early on, a long time ago, to begin forming a very strong partnership, not just between ourselves, but between the managers and leaders of our organizations, so that we started out by learning more about what each had to offer, our different levels and areas of expertise, to see if there were ways that we could leverage each other to improve the health of the state. And indeed, that ultimately led to monthly joint management team meetings. So every month, OPH, the Office of Public Health, and Office of Medicaid in Louisiana leadership have joint management team meetings to discuss a lot of the health concerns that we face in the state. One of the things that we focused on in our second round of contracts for payment reform in our managed care contracts was HIV and the viral suppression rate. So we actually used that as an accountable measure for them, for which they must reach certain benchmarks, or they get financially penalized. Public health offers a lot of expertise and assistance in that area. We use public health data to help manage that, to make sure that we're also identifying clients that may not have a Medicaid claim but are HIV positive, and so linking them to care as well. So we've been working very closely with the Medicaid office and its managed care partners to ensure that we have 100% of the people that qualify for Medicaid are actually linked to care, linked to a plan, and ultimately achieving viral suppression, which gives them on average 11 more years of life on this earth, and that's 11 more years of time spent with family and friends. And so it's well worth it in terms of the quality of life it brings this population in the state. And so we have begun reporting. We've begun reporting that quality measure in the adult core set, and it's made Louisiana one of only 3 states in the country that are currently voluntarily reporting viral suppression rates among its Medicaid recipients. So some of the key successes from our partnership with Medicaid is that in general, the collaboration between public health, Medicaid, and the managed care organizations was strengthened tremendously. It also raised, for managed care organizations, it raised the profile of vulnerable populations or populations with perhaps complex, specialized health or healthcare needs, such as the HIV population. And it also helped us realize, too, even more so, it hit home the importance of data. And as public health looks forward to the future of continuing to be the advisor and the conscience of the healthcare and health systems, we need to look also at this as an example that data, informatics, and analytics and what we do with all these operations really are transformational, and that we are using our existing knowledge and expertise, tweaking it a little for new applications for the 21st century, to where that we ultimately, our value add is much stronger than we could have ever possibly imagined. And our value add, the power of our data will actually meet the power of our love and passion for health of communities across the country.